again, I wish somebody would have told me, don't go into it because of the money or the flexibility. Patients are vulnerable if families are worried, and you're their voice. Okay, bodily fluids. So, so people are sick. There's, like, orthopedics is a little bit of a different kind of floor because people in orthopedics, they pre-schedule their surgery. Like, they go to the doctor's office and they say, oh, you know what, it's time for me to have a rotator cuff surgery. So they schedule that surgery. If you're on other floors like cardiac or ICU or medical surgical, all of those floors, those people weren't planning on being in the hospital. They're there, but they weren't planning on it. And so you're dealing with a different kind of population on those type of floors than an orthopedic floor. Because an orthopedic floor, generally, they're not as sick because the doctor wouldn't have scheduled the surgery if the person was so sick that the doctor didn't think they could recover. Does that make sense? Whereas on other floors, they're like sick, really, really sick, and they don't want to be there. But orthopedic, they come in, they get their surgery done, checked off, there for a couple days, head out. Okay, so that's the plan. Let's see. So bedpans, yes. Okay, so bedpans, they're there. And you are given a nurse tech to help you with that. But there's like 25 patients on a floor, and you have 5 of those patients, and your nurse tech is responsible for all 20 patients. And so they might be in another room helping somebody go to the restroom or get cleaned up, that kind of thing. And so the nurse is not going to let their patient sit there and whatever has happened. So yes, nurses have to be willing to get in there. We're right there, we're taking care of the person. And one thing, when I changed my major and came back, that I realized that you got to look at the person in the bed, not the circumstance, not the pee or the poop or the vomit or the, that kind of stuff. And just picture like your family member being in that situation or you being in that situation, and it kind of changes the whole perspective. But when I was in nursing school originally, I did not think that way. I was more like, oh, I don't know, this isn't for me. This is not for me. So, but I'll talk more about that. Okay, so, orthopedic nursing. Okay, have you guys studied anything with orthopedics yet? Like rotator cuff surgeries, hip replacements, or knee replacements, hip surgeries, anything like that, you guys? Okay, so let's talk about it. I'm just going to go over, and I need you guys to help me, okay? If somebody is coming back from surgery, let's identify the team that's going to help us. Because as a nurse, you're not on your own. It's a team thing. You don't have to know everything. You just have to know where to go to get the answer. So as far as an ortho knows, I've got my list right here. So, so you got to identify your healthcare team. So you've got the doctor, obviously, who did the surgery. A surgical nurse is going to call you up and give a report. They're going to say, so-and-so had rotator cuff surgery, and the surgery was over at this time and this time, and give you all sorts of information about the patient. You're going to have a nurse tech, like we were talking about, to help you out. Physical therapists. Are there some physical therapists, people interested in physical therapy here? Okay, all right, okay. Nutritionists, pharmacists, occupational therapists, and case managers to set things up for the patient going home, okay? So this is your team. Another person you could add on to here are lab techs, because you got to make sure, have you guys been exposed to labs yet and what they mean and how important they are? Like hemoglobin, hematocrit, when people need blood transfusions, okay? So you need to know all those people and how to get in touch with them if you need them. Okay, so say somebody comes back from surgery. What are some things you think you might be looking for with a patient coming back from surgery? Like they roll in, they're asleep, they've got their pain pump here. Do you guys have any ideas what, like some assessment type things without looking at my list? Yes. Inflammation, right. Because if there's inflammation, what could there be? Infection. Yeah, good. That's right. What other things? Okay. So like respiratory. Patients come back from surgery and they're not taking good deep breaths. If you're not taking good deep breaths, what could you get? Pneumonia? That would stink. You came in to get your shoulder fixed and you end up getting pneumonia. You know, that's a big problem in hospitals. Sometimes people come into the hospital and they end up getting an infection that they didn't come in with. So as a nurse, you're responsible to make sure they don't get another infection. So you're going to have that person taking good deep breaths. Even though they're still kind of conked out from surgery, the minute they start to wake up, you're going to say, okay, I need you to take this many deep breaths. Okay? Okay, do you guys know how to feel a pulse? Okay, so you're going to need to know all that kind of stuff. Why would you need to know, like if I've had surgery on my shoulder, why would a nurse come in and check my pulse? Right. And also, a nurse might start squeezing my fingers. Why would a nurse do that? Good, yeah. Okay, so, because if you've had surgery and all of a sudden you got like a really weak pulse and that nurse is squeezing your fingers and she's not seeing it refill, what could there be? Yeah, it could be a blood clot. So a nurse has to go in and assess those kind of things. We're kind of in the business of catching things. We're kind of the eyeballs at the bedside. You know, again, it's a team approach, and so like the doctor won't know that the patient's not blanching, you know, not know the capillary refill is not working if it's not being checked, you know, every X amount of time. So we're the eyeballs for the doctor. And if something's off, we need to let them know, because if not, there's a problem. Okay, so, oh, you know what? This person had surgery, and they wake up, they're starting to wake up, and they're like, oh, I can't feel my fingers. Oh, what's going on there? Oh. Yeah, you're checking for nerve damage. So also when they've had surgery, their arm might be asleep. There was probably a pain block there, right? Right? But like, what are they going to start feeling when their arm starts waking up? Has your foot ever been asleep? Tingly? That tingly feeling at the end of your fingers? So anyway, it kind of freaks them out sometimes. Is this okay? I don't know. So you have to be there, you know, checking that. You document all this stuff, okay? Okay, mobility. That's the PT people. PT. Okay, so PT, they are like in there right as soon as that patient is awake enough to move. You got to get your patient moving. You know, you kind of think, oh, when somebody's sick, you want to stroke their hair and, oh, it's going to be okay. No, nurses, especially ortho nurses, they're kind of kick-tail nurses. They'll go in there and they'll get up. You get up. Well, I just had surgery. Get up. Because our job is to get them home and to get them back where they were at a better place than they were before they came to the hospital. Not to stroke their hair and, oh, I'm so sorry. Here's some chicken noodle soup. Infection prevention, like you were talking about with the swelling. You're looking for swelling. What are some other things that might alert a nurse that there's some infection going on? Redness? Heat? Okay. Good. What about like with heart rate?
Caller.
Yes, ma'am.
I need to see Kelsey Moody in the front office.
Yes, ma'am.
Thank you.
So what about with heart rate? Okay. Yep, it's going to be fast. So, and what about, you said hot, but oh my goodness, we're taking vital signs like every 15 minutes or so, right? So if you see that temperature going up, you're thinking, uh-oh, fever, infection, looking for redness, swelling, that kind of stuff. Okay, pain management. We got to be careful with this, y'all, because we need people to stay ahead of their pain, but we can't over-sedate them. That's bad. Which means, over-sedating means like just making them sleep all the time, okay? Because that affects their breathing, right? Because if you're sleeping, you're not taking the good deep breaths, okay? And also, I know there's some things going on since I've worked on the floor where they've kind of not been as generous with the opioid, with the controlled stuff, pain medicines. So, you can work on alternative pain management. But a lot of times people come back from surgery with those pumps, and you got to be careful to watch their breathing, that they're not over-sedated. Okay, and then with discharge, you work with a case manager to make sure that they get home and have everything that they need. Okay? What do y'all think about that assessment? You kind of do that on 5 patients. Okay, when you're discharging a patient, you got to make sure they've got everything they need at home, but you also need to make sure, this is something that you don't really think about, but like whenever you've been put to sleep for surgery, your systems kind of stop a little bit, And so when the person comes back from surgery, do you know what an important thing to write down is? What time the surgery ended, but do you know if you're a nurse and the patient comes back, do you know what needs to happen within about 4 hours of them being out of surgery? They need to go to the bathroom. And did you know that that's actually a big deal? Because sometimes they'll try to pee, right? And they can't. And so if urine is in your bladder and it's kind of just building up there, you're going to start seeing them get distended. And if you're not keeping an eye on that and documenting that, like, oh my goodness, they've gone 8 hours without going to the bathroom. So sometimes we have to bladder scan them and see how much is in there and do a straight cath, and they don't like that. So it's important to, like, as soon as they're able to get up and move or do a bedpan, hey, you need to try to pee. You've been here for an hour, time to go. And again, nurses, they're not these sweet little stroke your hair kind of people sometimes, because we're trying to get you better, okay? And we don't want problems like infections with, if you do a catheter kind of thing for urine, it's called a Foley catheter. It presents risk of infection, so we don't want people getting infections. Okay. Oh, and by the time they leave, they have to do the other. They won't let them go home until that's been documented that that's been done. So, okay. All right. So, okay. So this is what. I told you a little while ago, my experience, I had a detour. So I went and the bedpan scared me away. I'm not going to lie. I could do the studying and the test, not a problem. I was willing to put the time in and the effort in. Again, you've got to tell yourself, I can take these tests. I can do this. I've spent time with the material. I know this stuff. Don't get freaked out and say, oh, I can't take the test. Go in and do it. Clinical, that was my problem. Couldn't handle the stuff. So now what? I'm a junior in college. So that's when I learned, you don't go into it because of the money. You go into it because of the patients. So I went and did the furthest thing from nursing I could think of, which was accounting. I know that's so different, but I thought, okay, well, I'm in Nashville. There's a lot of medical stuff here. So maybe I'll just work on the money end of hospitals. So I went and I did my accounting degree, but then when I got back out and got back into the hospital and did the money end of stuff, the first person I ran into, it was in an internship, and her office was right next to me, and she was a nurse. She wasn't working on a floor. I worked my internship was in an area called risk management, and it was when people mess up, when there's a mess up in the hospital, if there's a lawsuit or something going on. Vanderbilt University had a medical center, had a attorney there. And that nurse was the mediator between the attorneys and the doctors, because she could speak the language. So she knew both the legal and the medical. So she could speak the language. So she was kind of like the mediator, which I thought was kind of neat. I was over there doing the accounting, which looking back, it was pretty boring. I'm not going to lie. But, it wasn't messy or anything like that. So, But anyway, she was like, Christina, you need to go back and finish that degree. If you're that close to being done, just finish it. I was like, okay, whatever. So I went on to do, I worked in the Department of Finance at that hospital. And sure enough, when I moved over to Vanderbilt Medical Center in their accounting department, the nurse working down the hall from me was a nurse. The accountant working down the hall from me was a nurse. And she worked on grants. And so she would bring the money in for the hospital. She'd help write these grants. And she was, again, the mediator between the grant people. You see what I mean? You learn the language when you're a nurse. You learn the language, and you can be a mediator, not just for patients to doctors on the floor, but you can be a mediator for lawyers to doctors. You can be a mediator for the money people to doctors. So it's kind of cool. You learn the language. So that's kind of long-term stuff to think about. So I ended up going back and getting my degree. And the second time I came out, I looked at patients differently. So, I looked at them in the eyeballs. Like when they were going through that stuff on the bedpan, I looked at them and imagined myself or my family, and it was just a different viewpoint than I had when I was 20. So anyway, last thing, just specialties outside the hospital. Here's a list. So I worked with this nurse, this guy. He worked for the National Guard when I spent some time out in Arizona, and he was picking up a shift on my floor, and he had worked at an Indian reservation. The National Guard had sent him out to be a nurse on an Indian reservation. I was like, that's different. I never heard of that. Travel nursing, y'all, if you like to travel, premium pay for travel nurses. They'll send you anywhere in the country. You tell them where you want to go, and if there's an opening, they'll send you, they'll pay for you, and they pay a premium. There was this nurse I worked with when I was in Arizona. Her husband was a park ranger at Yellowstone National Park, and so they would spend the summers at Yellowstone National Park, and then she'd come down with her husband, and they'd spend the winters in Arizona because it wasn't cold. So she was a travel nurse. So there's some cool stuff you can do with it. I mean, you can work in an office setting. If you want to go sit in front of a computer, you're more than welcome to do that. You can work like in Blue Cross Blue Shield is here in Birmingham. Prison nurses, there's actually a really high demand if you want to work with that population. Prison nurses. Do you guys know anybody, or have you been exposed to any of this stuff? Did you know about it? I didn't know about it. No. So anyway, if y'all have any questions about these, I mean, I'll tell you what I know. I'm still learning as I go. But
Do y'all have any questions for her?
I'll try to answer them if.
We have about 6 minutes or so.
Okay.
You said already a CRNA.
Yeah.
So didn't you say something about the hospital paying for maybe some of that?
Yeah, depending on the hospital you work for. Sometimes they'll make deals with nurses. Every hospital is different. And so, sometimes hospitals, university hospitals, other hospitals too, will make deals with nurses that if you work with us a certain amount of years after you get it, or, why you're going to get your master's, that kind of thing. Yeah. Yeah.
If you're an orthopedic nurse,
Mm-hmm.
would you just assist the doctor, handing him tools and things? Or would
That's
you-
a surgical nurse. And I've been in there and when they were doing surgeries. If you guys ever get a chance to go see an orthopedic surgery, like if you choose to do the nursing thing, it is like a construction zone in there. I mean, you got bone flying everywhere. I mean, it's like, all over the place. I had no idea that's what it would be like. If you go the medical route and have chances to go in to see different surgeries, it's kind of interesting. But I did go in one time to see the procedure. I worked on the end where people came out of surgery on the floor and would deal with more like pain management and getting them home, that kind of thing. But yeah, surgical nursing is a whole different area if you like surgery.
So Eden, you were asking specifically about orthopedic nursing.
Mm-hmm.
Would that be more like in a clinic setting? Is that what you're saying?
Yes, there can be clinic, orthopedic clinics with orthopedics. I know I had a family member that just had, it was a knee scope done, and they were at the doctor's clinic. But I know like at St. Vincent's where I worked, they had the surgery center there at the hospital and then would bring them to the floor. So there's all sorts of different options with that.
Any other questions for her?
I'll try to answer them if you have any.
So raise your hands high again if you're considering nursing. Any kind of nursing. Raise them high. Oh, all of y'all wrong. Okay.
Okay.
If you're interested in becoming a doctor. Okay.
Okay, yeah.
Physical therapy. Okay.
Okay.
Physician assistant.
Okay, good.
Trying to think of any other stuff.
Did you know in some countries,
Radiology.
you're required to become a nurse before you become a doctor? Not here, not in our country, but in some countries they require that.
Become a nurse before a doctor? Really?
Mhm,
I know.
yeah.
Oh, I did. That's one thing. Radiology. Just kind of what your experience is just with the diagnostic portion of,
Mhm.
I guess, your diet. Are there
Well,
nurses that specifically work
in radiology?
or is that something more of a tech thing? Or?
Yeah, that's more of a specialty kind of thing. They had their own area, and so we'd send people off to radiology, and then they'd come back. And so that's again, another area in the hospital. The radiologist would read the report, and then we'd have to let the doctor know.
So basically, you're answering my question too. Is there a radiologist who's the doctor and then more like radiology techs? There's not really nurses in that department? Or is that not true?
I'm not sure if there are nurses in that department. Some types of radiology, I know that they need IVs and make sure that, like different dyes and things like that they might use to To be honest, I'm not 100% sure, but on our end, as far as floor nursing, you know, we'd send them off to radiology and then they'd roll back, and we'd have to keep an eye out for the the radiologist report to come back and let the doctor know it was in. That was kind of our.
Are there
I
any
think.
other, I guess, medical healthcare avenues that we haven't touched on that someone is interested in here? Madison? A veterinarian.
Okay,
Well,
cool.
I mean, you'll learn a lot being a vet. You'll see that there's a lot of similarity to humans and how you treat them and,
We, where I work, we watch them saying where they have to go to the bathroom.
yeah.
Before they can leave, we have to make sure if the animal goes through not like a neuter stay, but like a serious or more serious surgery. They have to make sure that they eat and can hold it down and then go back, like, to the bathroom before we let them leave.
Yeah. Yep.
There's a lot of similarities.
What hospital do you work at?
St. Vincent's.
St. Vincent's?
And right now I'm working in an area, like I said, I didn't know it existed. It's called wellness. And what we do, we go out to companies right now. And I've always had one foot in floor nursing and 1 foot in other. And so like when I was in Arizona, I did oncology. I did oncology nursing, inpatient. And then the other I did was research nursing at the University of Arizona.
Are there any distinct experiences that you have at St. Vincent's?
Oh, are we up out of time? Okay.
Thank her for coming. Thank her so much.
Okay.